name is Meshac Onguti. By profession, I'm a trained reconstructive and craniofacial surgeon based in Nairobi, Kenya. We have been practicing for quite some time. And during our practice, we have realized that there are a lot of things that worry people for whether they are at home or whatever it is. And mainly because now, because of the year of IT, internet and social media and everything else, people are able to find out that, look, what I have is not normal, or what I have is normal, and it's very different. And I would like to emphasize today something about what people call growth that occur in the body. There are two types of growths. There are those that grow on the outside of the body, that's through the skin or through another appendages that are there on the body. And there are those ones that grow inwards, which grow from the organs or tissues that are inside the body, inside the skin, in many ways on. But any growth behaves in a similar way. We divide these growths into two types. We call the benign. Benign is what we call non-significant growths. They are there, apart from causing either cosmetic appearance of either of the hand or of the face or of the ears or of the leg or of the abdomen. They really do not be able to interfere with the normal functions of the individual in terms of their activities, whatever is the case, apart from knowing that there's a swelling there. And people will always ask them, what is this you are growing, and what is happening, why is it happening? One thing you have to realize that I think the modern way of life has made it difficult for people to realize they have these growths because of the clothes. Because you see, when you are wearing clothes and everything else, nobody knows what is behind those clothes, and people cover it up. I've had patients, for example, coming in, and they say that they've got a small growth on the skin of the abdomen, and then they are worried, they want it to be removed because they feel that maybe the husband or the boyfriend is looking at them and these things that, but sometimes they tell them, look, in most cases, you realize that nobody knows. They don't even look at it and know that you're having this kind of growth. Now, one of the things that I will start saying is that these growths, a growth is a mass, is something that protrudes from the normal skin. It comes, it grows up. It's like a lump. It's like a lump that comes out. There are many causes for that. On the face, the most common ones is people, particularly ladies, or even men these days, they have what we call the acne. The skin reacts. And when they react up, they break down, and then after that they form scars and become like lumps. And they are there on the face, and there are a lot of pores in those particular spots. And if not treated, people, you always see that, look, the face is damaged. But being where we are, people don't worry about it. But we can easily, these days, we can be able to easily treat them up, not necessarily through the medication that are given, but we have other methods of like laser therapy, where we'll be able to clear that and create normal skin, so that which grows on quite well. But there are also growths which are normally called, which come because of rainbow, particularly the ladies who want to pierce their ears and everything else. And as they pierce them up, after a while, they start growing up. They start forming this, we call them keloids. And when they have grown beyond the area where it was done, it becomes a keloid, whatever happens now. And all these things also can be fixed very easily these days. Before, what used to happen, we used to hold them, they recur, but we now have very good methods of taking care of them without any problems. But they are also on the face, for example, particularly dark skins don't normally suffer from that, but white skins suffer from it. Where they have those swellings, and from that skin, that growth, they can form cancers, what you call the basal cell carcinomas, because of the skin they have got. Unfortunately for the Africa, we don't have that, and it's very rare that you have that kind of thing that occurs in. Even when someone has burns, when someone has burns, because he has burned the skin, when the growth occurs and beyond that skin, it forms scars and forms keloids. These are growths that occur. There are also growths that come in as a result of other things, depending on body reaction. You've taken something and it reacts up and forms pimples, and then it starts growing up. And these are very common, particularly on the buttocks, particularly on the hands, on the back, and those areas that come in this particular spot. So when you see all these things, people sometimes worry, and the most important thing that in normal, what we call normal ones that don't form cancer. Now, if it's a normal one, it will grow and it will show normal skin around it. But in most cases, if they turned, they say aggressive. Malignant means that the cells, instead of being naive, they don't do anything, they grow now, they become very active and begin destroying. They compete, they begin eating what's available there, and they destroy, and eventually you end up, that thing breaks down and forms a wound. Whether it's outside or inside the body, it forms a wound. And as it is growing, is it displacing or eating whatever is available and destroying, depending on where it is. Remember, if it was around the neck here and it was growing inside, and this is where you have so many things going in, and it goes to affect the vessels here. So eventually, the person will die because if it is the blood supply there, it will bleed to death and someone will be able to die. So you have to differentiate here that a malignant growth is one that has grown to an extent that is not controllable. It now takes over. It doesn't obey the normal body, control. That look, remember your skin here, every 8 days it's regenerating. That's what you're part of it. It keeps on turning over. And they work very, very fast on that aspect. Now, what happened is that because in most cases you cannot differentiate which is which, I always encourage that if you have any growth anywhere in the body, whether it's on the face, on the chest, on the back, on the legs, on the limbs themselves, it's always good to go to a professional physician or medical field so they can now look at it and tell you this has no significance. And sometimes, if those growths are actually excised, removed earlier, if not so, like if they're very small, we use the word less and destroy them completely, so there's nothing that you left behind to grow, you will be able to eliminate. There will be no history. Remember, if there's a growth and there's irritation all the time, constant irritation, that's a stimulus. The kind of food we eat sometimes, you know that there's some foods that are carcinogenic. There are things that we eat that will be able to stimulate those cells to grow faster. And then also, even, halko, for example, in our traditional busa, which is people take on that, even the ones, there's highly distilled ones, like, I don't know the name they use, the ones that have been matured for I don't know how many years, you see that they cost more, but also the effect of that is also more on various other things. That's what people don't understand. So these things, when you have them in place, you find that you have to know that a lot of cancer things is environmental, either through what you eat in the chemicals that you use in foods, for example. Some of those are not quite all right. Or the fear cause, the smoking. Smoking is a major stimulant is a major cause for cancer, particularly for the lung cancer and other things that are supposed to be there. So when you look at these, the most important thing that sometimes we look into that, if you are able to go to a doctor early enough, then and they can be able to see, and it's very easy to remove something small without causing much defect. Then when it has grown so big and they are destroyed areas, now you wonder if you treat it, are you going to make the morbidity of that patient? That means, is it going to be functional because it has destroyed that you are removing a lot of things around it? That's what makes cancer more difficult to treat when it has grown beyond that spot. I know that in most cases, when you mention the word cancer, it's like a death sentence to a lot of people. You make them to think that, oh, now I'm going to die. That is not what I should be able to, you should not think about that. Cancer is like any growth from the very beginning. If it is seen earlier and interception made earlier, that's perfect. It only becomes dangerous when it has grown beyond its normal site. It has gone to other areas, either to the bones, to the chest, to the other places, and becomes widespread, which means those cells are growing now, not only here, but they are growing everywhere in the body. And if you don't now, the treatment doesn't become one. You can remove whatever is in this area. For That's what you do with the ones that have already gone to the brain, whatever is the case. So now you begin wondering that, can we be able to combine the treatment? The surgery is done, and then follow it up with radiation and chemotherapy. Chemotherapy will take care of the things that are beyond, where they're spread or whatever it is. But this must be done appropriately. One of the things that the mistakes we make is that we tend to treat cancer monoblock by one direction. Say, let's give surgery or give chemotherapy or give radiation therapy. But if we combine in some of these cases that we sometimes are quite big, you can be able to combine this. Either you can do it before surgery, where you reduce the tumor, or you remove the tumor first, and immediately, when it is healed, so long as there's not so much effect on it, it's healed within 2 to 3 weeks, then you give radiation therapy to sterilize all those other microscopic invasions that have taken place, and then chemotherapy to take care of the other places in place. That can be able to improve on the mortality so the quality of life of these patients that come in place. So, and the main thing that sometimes occurs that when the tumor has grown so big and there's destroyed tissue around, then you'll know that you have caused more deformity. So when you do the surgery, what happens? And if the center is not able to reconstruct, you will replace those areas, those things that have been done, so that at least you can leave the patient slightly better than what it was, so that they can deal with the normal things. Let's say if it was, for example, cancer involving the oral cavity. If you removed the tongue and everything else, remember, you cannot speak well, you cannot swallow, you cannot be able to, even you can aspirate very easily because the food just drops in and goes to the lungs, and you can have frequent infections that is in place. So what I want to do, I want to construct it. So these are things that sometimes people have to wonder and think very seriously about. So in essence, one of the things that I have to say, look, and many people think that, you see, I don't know how we want to remove this kind of mentality in our minds that, look, there's nothing that occurs without being witchcraft in this country, where you see patients and then you say, a patient is there, particularly I'm talking about the rural areas, where I think people have been told that, look, this one, Omerowa. Let me tell you that there's nobody who has got power to do that in anything else. But people can take advantage once you have the growth, because they want either to, benefit from you in terms of paying them money, because they can't come to treat you without giving out this, or then they also create a rift between, look, your neighbor here. So you focus on that rather than focusing on how to treat that particular patient. With the modern way that we have got, with the healthcare system that we have got, whereby you can be able to go to the hospital and get a treatment, that could be the best thing. Forget about whereby people say, when a child is born, they already put things in place to ward away the chuchus and everything else. There are traditional things that were good, that used to, the traditional way of treating things, but not the ones which is trying to work on your mind that everything is bad. Cancer, this fellow, and how do you trust a chuchu that is going to treat your cancer? And he has no knowledge in terms of how the growth occurs. These are things that people must be able to accept and look at it. Now, you want to listen to a mganga, and you forget the modern way of looking at things. Even our forefathers never did that. They actually used to have specific things. They could be able to explain to you and tell you this particular plant. You can take it because we know the solution will be able to help the elements of it. But these fellows, they see ukiona growth wanakuambia hii Omerowa. Now, if, for example, and why is it that if they say there's a Korowa and they say they can treat it, that instead of treating it, you're actually seeing it growing and becoming unmanageable. And when they reach a stage, they now abandon and say, we can't do anything. And now you go to the hospital, and by that time it's too late, and we operate, or the patient dies. But they will not hear even this patient actually has been going around with their chuchus. He has come to the hospital. But the prayer now goes to those who have seen you last. But that's not where it is. So I would suggest that I think in terms of our public health, if we really need to improve on what is supposed to be the case, it is important that we educate people to know that, look, there are things that have got a scientific reason for it. Look at it, for example, when Corona came, we didn't just say this is Merowa. We have to follow the scientific way of looking at things. That look, and we have a way of assessing We have a way of assessing that this is malignant, this is not here. That's why we have got the laboratories where we can take tissues. That's why now we can actually be able to look at what's happening in your systems without any problems. So let's use that. What I know is that these things are expensive, but proper things are expensive. But they are cheap in the long run. They are not expensive at all. See, people sometimes look at it, if I spend this much, but you forget that if you are able to save your life, and you have got 10, 20 years or 30 years to come, that you can now work and generate income, it's the best thing that you can be able to have.